Now, another theory regarding linking biology with personality, it comes from the behavioral approach system and the behavioral inhibition system. So these are two systems, essentially, that essentially either push us towards something or push us away from things. And according to this particular theory, this is your gray is of course mainly associated with this. This particular theory essentially is saying is that there are that there's a kind of like a biological system, a system in our brain that essentially is involved with motivating us to approach the things that we want or withdraw from the things that we don't want. Okay. So that's what that is. The incentives are the things that we are drawn toward, and the approach system essentially regulates how we move toward these desired states, toward these desired objects. How intently are we going to go after that ice cream sundae? Well, that's our behavioral approach system. Someone who might say, an ice cream sundae might be nice, versus someone who will say, get out of the way, I want that ice cream sundae. There will be differences in their behavioral approach system. It's responsible for positive emotions. So there is so the approach system is connected with positive emotions. Because again, those things that we really like, there's a positive emotion attached to it. We want it. We really want to go after it. That kind of thing. And an interesting aspect about this is this, and this goes into, and we're going to talk more about this when we get into the learning aspect of personality. But you could learn through reinforcement. You could learn through punishment. Reinforcing good behaviors, punishing bad behaviors. Okay. But it turns out that there seems to be two different brain systems involved in reward and punishment. In other words, the behavioral approach system is not dealing with punishment. It is dealing with reward. It is dealing with positive outcomes. So in other words, if we are trying to train our approach system to essentially train ourselves to go after something and want it, it is the approach system that is essentially the part of our brain that is being activated to allow us to learn this activity. It's not involved in learning from punishment. So in other words, this is a system that needs nourishment, essentially, seeking to where we learn to go after the things that we want. And there are, again, people with different levels of approach sensitivity demonstrate different behavioral, emotional responses to incentives. Like I said before, with the ice cream sundae, is that you can either go after it, or it sounds nice, or you can go after it like a crazy person. Okay, and again, this seems to be related to dopamine activity. This again, and it kind of connects also with Eysink's perspective on psychoticism. An interesting thing about psychoticism, another aspect about it is like someone who has an antisocial personality, maybe like not really concerned about the welfare of others, and it kind of makes sense. Someone who really wants what they want right away may be less concerned about how they are affecting other people when they do so. So that kind of maybe fits in with the psychoticism, maybe where too much approach could be a problem. Now, on the other hand, you have a behavioral inhibition system. This regulates movements away from those undesired states or objects. So essentially, people who have that inhibition system, we all have this inhibition system, but it allows us to stay away from those things that punish us, to stay away from those things that could cause us pain. So we use the system to essentially regulate how we do that. And it's associated very much with anxiety. So obviously, clearly someone who has a high level of anxiety, and you think about neuroticism as well, they would be really wanting to stay away from those stimuli that might be dangerous. So they want to stay away from all of that. definitely relates to conditioning involving negative outcomes. So in other words, for someone with a very active behavioral inhibition system, they're going to be very responsive to punishment. For someone who does not have a very active behavioral inhibition system, punishment is not going to deter them. So essentially, you can see how that might work, where someone with a very overactive behavioral approach system is just going to go after what they want regardless of the consequences. Someone with a very overactive behavioral inhibition system is someone who is going to kind of want to avoid getting into any kind of trouble whatsoever. They're going to avoid taking any kind of chances. They are going to stay away from it, and boy, oh boy, they respond to punishment. Now again, the biological basis to this may be related to serotonin. It could also be related to GABA activity. Basically, GABA is an inhibitory neurotransmitter. It's a neurotransmitter that tells the nervous system to stop firing. So people who have low GABA activity are maybe more susceptible to panic attacks, anxiety disorders. Norepinephrine is related to higher anxiety. So high levels of norepinephrine, low levels of GABA may be related to a very active behavioral inhibition system. So, again, connecting to the traits as we've done before, the inhibition system is certainly related to neuroticism, because anxiety is at the core of all of this. And again, people who have a very active behavioral inhibition system are going to be very responsive to manipulations of anxiety. It's very easy to make them anxious. The people who have the behavioral approach system, the very active behavioral approach system, that is very related to extroversion. People who are high in behavioral approach, they are going to be very responsive to positive mood manipulations, which also could mean perhaps that they are susceptible to getting involved in having drug and alcohol abuse, because those drugs and alcohol feel good, and they will approach those things that feel good that will improve their mood. So again, with an overactive approach system, maybe consequences be damned, they'll just go after it. But again, these are different ways of looking at personality from these essentially two presumed systems that we have that push us towards the things that we want and keep us back from the things we don't want. And again, going over the various traits and systems and everything like that, there seems to be a little bit of disagreement. There seems to be some overlap for sure. I think that it may be several years before they come up with maybe some kind of a comprehensive theory that would combine all of this. But maybe we need to learn more about how the brain works in order for us to be able to do that. So in other words, the question is, to what extent is extroversion involving sociability? We can look at, and again, we're thinking about the social qualities of an approach system. People who take that approach system, well, there are social incentives as well as other incentives. So maybe the people who take the behavioral approach system, maybe they're high in extroversion in that they can, because the social interactions they get are rewarding, so they're pushed towards social interactions. So, that's a type of reward. The impulsivity could be linked to extroversion, maybe not. On the other hand, is it a separate trait, kind of like a reverse of conscientiousness? The Big Five theory would say that it would definitely be a separate trait. Then again, you can say that impulsivity with the positive affect belongs with extroversion. So someone who is, impulsively, spontaneously looking for good times would certainly be considered an extrovert. And they do spontaneous things that are enjoyable. It sounds a little bit like sensation seeking, which we're going to talk about next. The impulsivity, though, maybe they don't necessarily haven't been found to load with the approach system or extroversion items in a factor analysis, which means that there's a lot that there's still question marks about. Bottom line is this: we need to know more about the brain and the processes underlying our behavior. We need to kind of get a clearer definition of what behaviors we want to talk about. How clear is our definition of extroversion, impulsivity, etc. So these are some areas where I think there could be some future both theoretical work as well as research studies to be done to kind of answer these tough questions. Let's talk a little bit about sensation seeking. This is essentially a personality trait that seems to have a biological basis to it, and it seems perhaps to be related to the maybe some of the approaches we've been talking about before. The high sensation seekers are looking for new, exciting experiences. They want to do the new thing and try it, and they like going for adventure and trying these things. They like to drive faster. They're more likely to engage in drug and alcohol abuse. They engage in extreme sports. They engage in risky behavior, sometimes risky sexual behavior. They are often dissatisfied relationships because maybe the stability might bore them, for all we know. And again, the argument here is that there is a biological basis to this particular characteristic as well, and that has to do with the MAO chemical here, hormone, which is involved in sensation seeking. So the MAO is related to related to levels of sensation. Excuse me one second. Okay. So monoamine oxidase is again a brain chemical that is involved in sensations. That seems to be involved in sensation seeking, but then again, it could also be something that is involved with serotonin, which is another neurotransmitter in the brain. But let's take a look at some of these. Let's take a look at some of the sensation-seeking items to get an idea of what kind of questions to ask. So let's click on this link over here, and we'll bring up the sensation-seeking scale. Take a look at some of these items here. Number 1, I like to have new and exciting experiences and sensations, even if they are a little frightening. True or false? So if you answer true to that, then that indicates high in sensation seeking. You want that activity. I like doing things just for the thrill of it. Also true. I sometimes do crazy things just for fun. Also true. So these are items that would indicate a high level of sensation seeking. Now look at item number 13 on the other hand. Before I begin a complicated job, I make careful plans. Well, in this case, the high sensation seeker would say false on that one. Someone might say, I usually think about what I'm going to do before doing it. Also, a high sensation seeker would say false on this item. So anyway, it's a 19-item scale. And I noticed that where this comes from is part of a driver qualification test in the government of New South Wales, Australia. So apparently in Australia, they don't want people with too high sensation seeking to be getting their driver's license. Maybe that makes kind of sense. You don't want your driving to be just an exercise in risky, exciting behavior. You just want your driving your car to be safe and get you to where you want to go. So that's just an interesting application of using this particular measure here. Okay. Let's go back here. Okay. So what do we need? What is sensation seeking? So what it does is we need to get a certain amount of stimulus intensity. Some people want a little bit less. Some people want a whole lot of it. The high sensation seekers want a whole lot of that intense stimuli, external stimuli. So they will seek it out. They like those overstimulating conditions. So if there's a particular job that involves working in a very loud a loud place, something like that, the person who is a high sensation seeker would do better in those kind of places. The introvert, the low sensation seeker, would prefer being in a quiet, peaceful place. But again, the low sensation seekers have difficulty when things get too arousing. An interesting extension of sensation seeking are the impulsive, unsocialized sensation seekers, in which they go beyond just wanting to seek stimulation. They also just are unable to inhibit their own behavior, so they will be inappropriate. They will seek out the stimulation even when it is inappropriate to do so. Kind of leads us a little bit towards impulsiveness. Again, another trait that seems to have some kind of a biological basis to it. Okay. So we can look at, for example, the approach and inhibition systems in terms of identifying and understanding impulsivity. So someone who has a high approach system, they certainly want to get something, they'll go after it, and they have a low inhibition system, meaning that they want to, they essentially, nothing holding them back, then they're just all forward all the time, and they're definitely impulsive. So they would need a combination of both of these in order to be considered, would be considered the most impulsive. Serotonin may be related here. That the serotonin, maybe the low serotonin could be involved in anger and impulsive aggression. High serotonin levels are related to conscientiousness, so kind of like that makes sense. That there's a conscientious person who is certainly not going to be impulsive. They plan everything. They're responsible. They'll have higher levels of serotonin. So perhaps the impulsiveness also is coming from a separate biological system. Question is what?